Good day, everyone. Today, I'm here to present to you my capstone project entitled Medical Errors, a symptoms of incompetence or the healthcare team cry for help. Let's talk about the medical error here in Canada. There are reported 29,000 cases based on the 2019 census. I know, it's not bad, and it's made worse by the pandemic, giving the rise of what we call a dual crisis. What could be the meaning of the rampant cases of medical error? Some say it is a symptoms of incompetence, one where our healthcare team is purely on blame, or maybe it is a healthcare team cry for help. This is a problem that is beginning to be much more to handle. For example, for some healthcare nurse, they are in mental health and physical distress and have increased of likelihood to commit more errors. Action is needed, especially since we can afford to do more error in the healthcare delivery system. But where do we begin? I present to you the 4-point plan design to run over in 2 phases. Let's turn our attention to the first phase, the strategic planning phase that aim to run for 2 to 3 weeks. This phase, we form ad hoc committee to manage assessment data, quality monitoring, and overall spread of management of medical error. Then we can meet with the team and set goal to outline the plan and begin with the first half of the assessment of what caused the medical error through staff interview during the meeting itself. After the plan is in place, we are armed with the vulnerable data for the staff so we can proceed to the step 2, the execution phase, where a single cycle of the 4-point plan is enumerated. This plan is designed to run for 3 months and it is sufficient data has been collected so we can proceed to conduct the follow-up meetings. In this phase, it is patterned to overall nursing process where we begin with the all-important assessment in the area. Assessment in the area, this is where we interview the patient for feedback and start our observation to the unit environment. The unit environment where we can identify the area itself that may be what is the cause of medical error. After completing the rounds of assessment, we proceed to the mitigation, and in mitigation, we have a preventive measure against a medical error are put into action. This can be general preventive, for some preventive measure like mandatory double checking of documentation, implementation of the barcode scanning devices, and other clinical decision devices, etc. Monitoring follow-up after is where we can evaluate the effectiveness of the preventive measure and flag medical error as they occur. And after that, every time we flag something during the monitoring phase, we proceed to the correction phase. The correction phase is to implement the corrective measure of medical errors and to enhance or change a preventive measure in place. Their effectiveness is evaluated. The corrective measure here is case-to-case basis because since the situation is not always the same. However, it is important to remember that all corrective strategies employed will be evidence-based. Lastly, we proceed to the follow-up meetings. In follow-up meetings, this is essential for synthesizing assessment data, update the plan, and made her an institution-wide or the unit-wide policy changes are also deliberated. The next, we can proceed to the expected outcome of the program, the plan, and maintain its sustainability for expected outcome. We divided in short and long term. Here in the short term, we expected to have ad hoc committee launch, follow-up meetings are scheduled, assessment data collected, and the program execution reach institution-wide. For the next one, the long-term outcome. In the long-term outcome, we have to mark a decrease in medical error, policy protocol correction, and tailored fit according to the assessment, and increase the staff vigilance regarding the medical error. The next one is the sustainability plan. We have 4 steps on this plan. Overcome barrier, educate staff and endorse, achieve and update the policy, and maintain the transportational leadership. In overcome barrier, it is important that we are able to identify them first. Here are the few examples. Inconsistent standard, decreases the perception, overwhelming lack of resources, and incompetent leader, lack of consensus with the next management. All of which can be solved through the proper communication communication and strong leadership guide. The next is the staff education and proper endorsement. The third one is we can achieve of resources and updating the policy to ensure the performance may be changed. And of course, the last one is the transformational leadership, because no amount of planning or good program design can even work without the support of a leadership. And this is all. Thank you for listening. I hope you learned something on my slide. Thank you.